Hi guys. Welcome back to RT Share T, where respiratory therapists live out loud. With me, your host Linda Fry, the asthma lady. Yes. Welcome everybody. Welcome to anybody new. I want to say thank you to my guest co-host from last week, Heather Margatroyd, who did a great job sharing her perspective and journey on being a clinical specialist in the diagnostic fields, PFT, and in the sleep medicine department, and doing this as a respiratory therapist. So that she shared some gems, and even for me, it was pretty cool because I'm not familiar with that role. So she did a great job. Thank you, Heather. So yes, and I just want to tell you guys that we have a whole 2023 RT Share T. We have a lot going on. So please know that we are growing together, and thank you all for the support. So today's episode, we are going to talk about patient advocacy and what that looks like, in a practical sense. And so pretty much this month, this week being the end of Black History Month, the Asthma and Allergy Foundation of America highlighted the work that I do around asthma, fighting asthma disparities and asthma management and awareness. So they highlighted all the work that I have been doing in Brooklyn, New York for all these years, and it just meant everything to me because I have been doing this work for so long, and I am about fighting for what's fair, giving everyone a fair chance to live their best quality of life that have asthma. And to me, it should not matter what your zip code is. You should not be suffering or dying from asthma. It's crazy, So me, myself, I understand how difficult something like that can be because I am a first generation born in America to my Haitian parents. So I was the oldest, and I had to help them navigate this through the healthcare system as a sick child. I had severe asthma at the age of 8 years old. So I always share the story of what got me into the field, but this time I'm starting to tell more of my childhood story as well, because this helps people to relate to what's going on. So I didn't have health insurance, or very little health insurance. My parents didn't have it. So when I was sick, it was hard for them because they would have to leave work to come pick me up from school, and they had to choose between paying utility bills and paying for my medication and paying for my medical bills. And there were times, and I shared that story. That's a hard story to share, that we had to do our homework next to candles, but the homework got done. Right? My teacher and my teacher would be like, well, what happened to the loose leaf paper? Mind your business, okay? The homework got done, right? And having to wear coats, because couldn't pay the gas bill, had to wear coats to bed, so those are hard stories to share. But I want people to know that I can't make that stuff up. Those are real stories, and those are things that people still go through today. So we have to understand that I meet patients, and these things still happen. You could meet a patient that is wearing $200 sneakers or a Gucci belt, and can tell you they don't know where the next meal is gonna come from, and you're just like, and if you're not used to this type of work, then you're not going to understand what trauma sometimes looks like and priorities. So some people will be like, well, this person doesn't have their priorities straight. But sometimes the priority is to let society know I'm all right. I'm doing okay. And these $200 sneakers is telling society that I'm doing okay. This Gucci belt is telling everybody that I'm okay. And then as somebody, as a healthcare professional, as a respiratory therapist, as an asthma educator, as a case manager that goes to patient homes, this is when I can truly see that they're not doing okay. And it's like, wow, what can I do to help you really be okay? So this is where it comes what I talk about, patient advocacy and just being a voice sometimes for folks that don't even know they need the voice, or that they need help, and it's a cry for help sometimes. I remember I love to share my stories, and these are all true stories. I cannot make these things up. A long time ago, one of my cases, my team, they're community health workers. They came to me and they said, Linda, we have a case. It's a complicated case. They showed me the pictures and they just said, listen, we don't think that we're getting through to this person. So the daughter had severe asthma, kept coming back to the emergency room, and was a frequent flyer in our inpatient unit, our pediatric inpatient unit. It was so much that we couldn't say her name because it would be like, that's when she would be on the floor, right? So the mom, so the community health workers were like, Linda, this is a difficult case. We think you should look into it. So there is a protocol in our program where the complex cases get bumped up to me. So I'm like, okay. So I reviewed all her notes, and then I looked at the pictures, and then I met her in one time before I went to the home in the asthma clinic. And when I tell you, the guardian, the mother, she was well put together. Like, I came there to reinforce the asthma education that the team had already provided. And her hair was done, makeup, she was dressed to the nine, and she had 4 kids. And to be honest with you, just working with her, looking at her, I felt like I had to get my life together. Like, I barely brushed my hair that day. So, so I was just like, well, what my team was telling me, it just kind of wasn't matching what I was seeing. Until I went to the home. When I went to the home, my heart fell to my feet, because I could not understand why somebody would live like that. So, to make a long story short, her home was in poor condition. It was in bad shape. And I was trying to help her as much as I could. And I noticed that she was using retail therapy. She was shopping to help her cope with what was going on. So basically, her landlord was trying to put her out, and she was trying to hang on to this apartment, so they were not fixing anything. And she needed a lot of things fixed, and this was 8 people, so 6 kids and 2 cousins, living in 8 people living in a 2-bedroom apartment that was falling apart. And so anyway, I was helping her, coaching her, giving her asthma education, remediation plan, and we did all this stuff. We hooked her up with an attorney and went in that aspect. So when it comes to our funders, once a month, we had to, come together with the other program managers and all the admins, and we would discuss the successes and challenges of each program. So I mentioned this specific case as the case manager and just described what was going on and what I was seeing. And the progress, was slow, but we were getting there. And one of the nurses who was sitting across from me, she said, after she heard the condition of the home, she said, oh, this sounds like an ACS case to me. It sounds like you need to call Child Protective Services into this case. And I looked her dead in the eye and I said, absolutely not. I said, absolutely not. And I think when I said that, she was taken aback. But you have to understand that our asthma program is a voluntary program. She opened the doors to us and she needed the help so bad that she was willing to let us come see her in her truth to help her child deal with her asthma and get it under control. So I am not a social worker, but I do know what a beaten child looks like, what a malnourished child looks like, what a neglected child looks like. And the kids in the home, I've been there several times, were happy. They were happy. They were well fed. They just were joyful. Okay, so that's not what I was looking like. So that lady did not come to us to have her children taken away from her because she was in a bad spot with her landlord or whatever else was going on in her life. So I had to advocate for her that it's not an ACS case. I'm not calling Child Protective Services. What she needs is additional resources. I'm giving her everything that I got. Everything in my bag I'm providing for her because I want her to have a fair shot. So once I present it to her, I say, hey, listen, we have free legal services. I'm going to plug you in. I'm going to get you the next appointment. It's a long line. I'm going to plug you in, but I'm going to need you to put an alarm on your phone to remind you to get to the appointment. I can't go to the appointment for you. You have to get to the appointment. And she followed through. You understand? So we developed a partnership. And can I tell you guys that every recommendation that I made, every piece of advice or whatever, she took. And I saw the progress during every home visit. It was amazing. And can I tell you, her daughter was not coming back to the ER in the inpatient unit. Success. I was so happy. It's one of my success stories and my cases, because I literally seen the patient go from A to 8.1 and 8.2 to 8.3 and then to B. You understand what I'm saying? Because we can't get folks from A to Z in you know what I'm saying? Like we have to be on their pace and on their journey. So that's what patient advocacy looks like to me. And I continue to encourage everyone that's in the healthcare field, when you are put in this position where you're taking care of patients and you see something, speak up. Speak up. There are a lot of people who are they just don't know how to stand up for themselves or to ask for the appropriate resources, and who may not even know their rights. Okay, so yeah, guys, so that's pretty much it, and I hope you learned something from me here today. I love sharing these type of stories with you guys and just all these experiences, and just giving you another perspective of hospital work, going to also the community and inpatient homes and stuff like that. So know that we are here every Wednesday on Google Podcasts and on most podcast platforms, and we are also on YouTube every Thursday. And like I said, we are growing together. So much more to come in 2023, and thank you for everyone for the support. Yes, guys, so I will see you next week, and remember to invest in yourself and to only compete with yesterday's version of you. All right, guys, see you next week. Bye.